With more than 400 known websites actively spreading myths and misinformation about COVID-19, separating fact from fiction is often no easy task.
If you're healthy, you will probably go through a process and you'll be fine.
Right now, the CDC is saying masks should only be worn if you're sick or you're taking care of someone who is.
It's about the rational use of masks. We have provided guidance about using a medical mask in the community. And if you're not sick, you shouldn't be wearing a medical mask.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat.
We asked GV students what they still needed to know about the virus and the vaccine, and gave them to a leading epidemiologist, connecting them directly to a credible source of knowledge, and hopefully clearing up any lingering uncertainties.
I'm Jennifer Nuzzo. I am an epidemiologist and an associate professor at the Johns Hopkins Bloomberg School of Public Health and a senior scholar at the Johns Hopkins Center for Health Security.
Should I still get vaccinated even if I've already had COVID-19?
You should still get vaccinated if you've been infected in the past. The CDC recommends it, and it's safe to do so, and it will ensure that you have adequate protection to the virus.
So why is there a waiting period between the vaccines?
We want to give your immune system extra time to challenge it again. So the first time your immune system is going to respond to the protein on the surface of the cells, and it's going to actually kill the cells that are expressing the protein. And then we want to challenge it again, and we need some time for that whole process to sort of shake out. The second challenge will lead to a stronger immune response.
How long is the vaccine effective for?
We don't fully know, but so far the data that we've collected suggests that it may be effective for at least 6 months. I expect that it'll be effective for longer, but we're still collecting the data and trying to understand.
Is it going to be like the flu shot where we have to get it every year?
That's a bit of an open question. I think it depends on how much the virus changes and how much we're able to drive down infections through the use of vaccines. It's possible that we may need a booster in subsequent years like we get it for a flu shot, but it's also possible that we may not.
So I've heard a lot of debate about who is more likely to get sick as a reaction from getting the COVID vaccine. So just seeing some clarification or some science, if there's any data behind that, would be nice.
So not everybody develops side effects to the vaccine. It's really a bit up to your body and how your body reacts, and everybody's a bit different. Some people may get side effects after the first vaccine dose. If you're getting a 2-shot vaccine, some people, typically more people get side effects after the second dose of vaccine. But some people never experience any side effects. And it's important to know that that doesn't mean that you didn't have a good vaccine. You are still protected. It's just that that's not how your body chose to react.
In the social sciences, things like the peer review process and access to all raw data can influence research, specifically the perceived integrity of that research and how the public perceives it. In what ways does vaccine research strive for transparency in both the public and scientific domains?
So vaccines that are developed have a fairly rigorous set of requirements regarding the conduct of clinical trials and the availability of the vaccines. There are many, many checks that are put into place. The first being that the existence of clinical trials is usually something that's published, that you can see and understand what clinical trials are ongoing. And then, of course, in terms of trying to get a vaccine either approved or authorized for use, it's subjected to a rigorous review by a scientific committee. So it's a fairly, there's a lot of oversight and a fair amount of transparency. I would say a great amount of transparency, which is really essential, I think, for making people feel comfortable with the results.
What is mRNA, and how does an mRNA vaccine differ from traditional vaccines?
So mRNA stands for messenger RNA, and it's basically the instructions that cells can use to make things. In the case of the mRNA vaccines, it's instructions that are given to your cell usually it's your muscle cells where the vaccine is injected, that will then take those instructions and use it to make a protein. The protein then is put on the surface of the cell, and it's there for your immune system to see and recognize as foreign, which will train your immune system to later spot that protein on the surface of the virus. It's the same protein actually that the virus uses to adhere to your cells and cause the damage that it does.
In terms of anxiety, we know that it can produce a lot of physiological side effects or symptoms. How can the experience of anxiety conflate the vaccination experience, and what advice is there to help recipients combat this experience of anxiety?
Often when people are getting vaccinated, they may feel just anxious about that clinical encounter or just the fact that they're getting a vaccine. So it's not uncommon for healthcare providers to report that people are anxious. Sometimes people get so anxious that they may faint or other things. So it's one of the reasons why they have built in sort of a 15 to 30 minute observation period. So after you get the vaccine, your healthcare provider is probably going to ask you to stick around for a little bit just to make sure that you're okay. But in terms of anxiety after vaccination, let's say you develop anxiety, since you've been home, I think just the important thing to do is just check with your healthcare provider to make sure that it's just a normal situation. So the Food and Drug Administration and the U.S. Centers for Disease Control and Prevention recently announced an intention to pause the use of Johnson & Johnson vaccine. And they reached this decision after hearing 6 reports of people who developed serious blood clots following the receipt of the Johnson & Johnson vaccine. But I think overall it represents a good sign that there is a very robust safety monitoring system in place here in the United States that caught these 6 events and paused the use of vaccine just to make sure that there isn't a larger problem. We don't actually know if there is a larger problem with the vaccine. I think we should so far be reassured by the fact that only 6 cases of this event have been reported, but we might hear more in the coming days now that there's additional clinical attention on this condition. So I think it's smart to pause and just to make sure that we fully understand the safety of these vaccines. And I expect, provided there aren't any more concerning data that come to light, that they'll resume the use of it, possibly suggesting that people who are at highest risk for developing these blood clots to use other vaccines. But I do expect that we'll probably resume using Johnson & Johnson vaccine. And I think, when and if that happens, we can feel confident about that decision.